Kids and parents rely on schools for vaccine access.
When the school program stops, it really is a hazard in terms of uptake of vaccine.
That confirmed by a new survey from the University of Toronto and vaccine advocacy group 19-0. Asked whether their children missed their school-given HPV, hepatitis B, or meningococcal vaccines since the pandemic started, just over half said they got them elsewhere, but the rest said they either weren't sure or, yes, their child definitely missed those vaccines.
Ontario closed more schools for a longer time than any other province. And in terms of the school programs for immunization, Ontario is the most behind of other provinces.
Public Health Ontario data shows that less than 1% of grade 7 kids during the pandemic were up to date on their HPV shots, and in that same 2020-2021 school year, only 17% of those kids got their Hep B and meningococcal vaccines.
We're not going to see the repercussions of this for years to come.
This family doctor says it needs to be addressed ASAP. Just last week, Toronto already saw a small outbreak of meningococcal disease in 3 people turn deadly. So when it comes to that vaccine,
got to get that number a lot higher than it is in order to keep our kids safe.
So I was like, oh, I got to get on that.
After the last chaotic 2.5 years of pandemic parenting, Romana Siddiqui decided today was the day to get her kids up to date.
So all 3 of your kids will be caught up on their vaccines come September. Do you feel relieved?
I'm glad that I'm getting this done before school starts, because again, with the hecticness of back to school, it's a very easy thing to slip through the cracks.
Experts say public health clinics, as well as family physicians and pharmacists, need to work in tandem to fill in some of those cracks and ensure more children get caught up on their boosters. Ali Chiasson, CBC News, Toronto.